without quorum, will be unable to take action, but we will nonetheless be able to have a conversation about a variety of things. I do just want to call our attention to the Providers Council meeting schedule. We won't take action on it, but it was included in the packet. Thank you to Megan and the group that put that together. But if everybody can just make sure that you're taking a look at that, getting them on your calendar, that would be helpful. And then when we get back together, we will take action on it in February. So what you can see there is what we had agreed to throughout the year is that we went from having 2 meetings as a joint Providers and Funders Council to 4. We agreed to 4 meetings. So as you know, we tend to meet every other month or 6 times a year. 2 of those meetings will be as Providers Council alone, and the other 4 will be with the joint meeting with the Funders Council. And the schedule there, as you can see, is intended to try to get us ahead. Of conversations so that we're getting information to our municipalities and county and others as decisions are being made in advance of NOFOs and budget packets and all the things that happen. So what we're trying to do, as you know, is kind of our perpetual calendar. That we can depend on. Every April we're having certain topics of conversation, and every June we're having certain topics, and every that kind of thing. So anyway, just get it on your calendars, because we really do benefit when everybody can be there. I will say the December meeting, if you go back to the Providers Council charter, we are actually by charter required to have 5 meetings, a minimum of 5 meetings a year. And the 6th meeting is kind of optional, so to speak. And we often cancel December because of the very reason that we have right now, which is it's hard to get quorum in December. And so we didn't cancel this meeting because we had missed a meeting previously, and we really needed to kind of gather if we could. So anything anybody wants to say who's on about the schedule, any concerns about the schedule that's in front of you? Okay. The next one is really about the service expert election. So we're not going to be able to take action today. Lariana's term is expiring at the end of this month. She is eligible for re-election. I did reach out and speak to Lariana. She is willing to go either way, which is to seek re-election or to allow another member of the Providers Council to kind of put their hat in the ring to be a part of one of the identified service experts that would then attend the board meetings and lend voice to the issues and concerns that we address at the board meeting. So we're not going to be able to take action today. I will send an email out or ask Kevin to do it. Just so everybody knows, I am serving as the vice chair. Kevin is out today because of his fundraiser. And in any case, I'll ask Kevin to send out an email asking all of our Providers Council if there's somebody who would like to throw their hat in the ring. We, per charter, are able to take action via email and electronically, and so we may need to do that in advance of the February meeting. So we'll get Kevin to work on that. But if anybody who's on the call is interested in serving as a service expert on the board, I would encourage you to respond to the email when it comes out. Any questions about that? Okay. It's hard for me to see everybody, just so you know. So just shout out if you have something that I can't see. Okay, the Rapid Rehousing Landlord Risk Mitigation Fund Review. Alex, tell us what you want to tell us.
Hello.
Hi.
I'm Alex Strider. I'm the Director of Program Services here at HLA. I just wanted to briefly talk to you about the Rapid Rehousing Risk Mitigation Fund. Megan, would you mind pulling up that slide?
I can see it.
Oh, can you?
This is
Yeah,
it.
I can.
Perfect, thank you. And this is funding that was received from the Pinellas Community Foundation back in 2018. It's specifically for rapid rehousing to help to pay for damages to a unit above and beyond the security deposit amount. The maximum amount per claim is $500 total. We have paid out three claims totaling $1,346.86. So two of those claims were for the maximum amount of $500, which means that the landlords had to pay out of pocket for any damages more than that. However, all of the landlords that we have paid out of this fund have been willing to continue renting to rapid rehousing participants. So I think that's important to note that this fund is not just to assist with the recruitment of landlords to help ease their mind a little bit of if their concern is that rapid rehousing tenants will destroy their unit, but also to use it as a retention tool so that if something does happen, that we are able to provide a little bit of financial support, even if that means not making the landlords whole, so that hopefully the landlords will continue and to be willing to rent to our participants. And I think the fact that it has not been heavily utilized is a selling point in and of itself. So I think the main question and why I was asked to be here is how landlords would access this fund. If needed, and as long as there are available funds, which there are right now, there is $18,653.14 remaining available in the fund. The landlord would reach out directly to the rapid rehousing agency contact that they've been working with. Typically, that is their housing specialist, and they would obtain the claim form, fill out that paperwork, submit the required documentation to the rapid rehousing agency within 30 days of taking back possession of the unit. And then the rapid rehousing agency would then submit everything to HLA. We would review all the documentation, and if HLA leadership approves it, then we send out the check payment for a maximum of $500 directly to the landlord. And we would then, of course, advise the rapid rehousing agency of the status. And the slide, along with the copy of the claim form and some other related documents to the Rapid Rehousing Risk Mitigation Fund, are in the agenda packet that Megan sent out. And I'm happy to answer any questions.
Thank you, Alex. My question, my observation of this is kind of exactly what you said, which is that simply having it available and being able to share that with landlords goes a long way. Whether or not they would ever need to use it, just the fact that it exists has been exceptionally helpful. My one question is, have there been any requests for claims in higher than $500 that had to be denied because of the $500 limit? Has there been any of that?
So two out of the three claims have been higher than the $500, but we only pay up to a maximum of $500. We have received some other claims for things that were not damages, so for rent, water usage, things like that, that were not applicable to this fund. People have tried to submit that we've had to deny.
Mm-hmm. I would ask maybe that we put on a future agenda to talk about the $500 max. Since we have funds available, it's not being used as often. Perhaps that we would consider increasing that $500. It's pretty low.
It is.
All things considered, and given, for example, what I'm going through just, with the renovations and what so many of us are going through. I know Kathleen is rebuilding, and, a door costs more than $500, literally to purchase a door and rehang the door with all of its hardware, including a door handle, which apparently does not come standard, just so you know. For those of us who are hanging doors, they don't come with handles. And so anyway, it would cost more than $500 just for a door, right? So if somebody kicked a door in or something, anyway, we might want to increase it. Kathleen, I see that you have your hand raised.
I do, thank you. I think this is great. It looks like, there was an allocation of $20,000 in 2018, which is good. But I mean, that money's been sitting there. So, hopefully it's earning a tiny bit of interest or whatever. But I'm thinking about how we can use it to attract more landlords. And if it's being advertised enough by our rapid rehousing agencies or housing specialists, do they market it? Is it, certainly it would be attractive, I would think, And I think to April's point, expanding the maximum coverage might help as well for the reasons April mentioned. But also, if somebody skips out on rent or whatever, maybe we want to, if we bump it up, we can cover some of that. I mean, the whole point is to lower the risk for a landlord to take on a potentially risky tenant, right? And it looks like it's not being used enough, which can be both good and bad. Good that we've got good tenants, or bad that landlords aren't opening themselves up to needy clients, and so anyway, I would just think, like I said, the $500 is low, and maybe expanding what it covers could help get some more landlords on board. But that's just, yeah.
And I
Thank
just
you.
want to clarify that it's above and beyond the security deposit amount. So if the security deposit is 2,000, the damages would then have to be above that, and that's when the risk mitigation fund would kick in.
Helen, you're recognized.
Hi, thank you. Sorry, I was a few minutes late. But what Alex just said is what I was going to confirm is that, and what I think a lot of it might be why we're not using it is landlords are now, we have a rapid rehousing program that we fund, and I said, and landlords are asking for triple deposits.
Mm-hmm.
So the need for that, it's plus first and last month's rent, right? And so the need might not be there as much as it was in the beginning when we first started rapid rehousing, because they weren't asking for that amount of deposit. But I do wonder if we don't, and this is something that as a funder, we, on the flip side of being a funder, since we're in Providers Council, we can kind of recommend to agencies that are doing rapid rehousing that, hey, in lieu of asking for this triple deposit, we have this risk mitigation fund and it will cover this. And so maybe that conversation is had on the front end versus the back end of this. And that might help us bring down the need for such a high deposit.
Mm-hmm. I will say that as a rapid rehousing provider, that to answer one of Kathleen's questions, which was around, are we sharing this information with landlords? And so yes, we are. And in fact, we have seen once the risk mitigation, because it didn't always exist, but once it kind of was set up, we've used it a lot actually, and just in terms of saying, you're safe, you're protected, you're, those kinds of things. And it goes such a long way. It's not ever necessarily about needing to use it as much as it is about knowing that it's there, that this safety net actually exists. So I'm not as concerned or offended that the $18,000 sits there unused, quite frankly, because we're able to say to our new partners, our new landlords and that kind of thing, that it's there, and that gives them a sense of comfort. I do, however, love what Helen said, which is, perhaps we could leverage it to start reducing, this 3 times the rent as a deposit started really right around the pandemic. Housing costs were going through the roof. The pandemic hits, and it was almost like overnight. We went from, 1.5 times the rent for security deposit to 3 times. Like if you weren't even going to be considered without 3 times. And so maybe we can start, trying to get that trend to go back the other direction. So that's something I certainly will move forward with my team to see if they can't start having those conversations. I don't know if we're ever going backwards, by the way, but maybe. Housing right now, as you know, is worse now than it's ever been, predominantly because of all of the displacement from these hurricanes. And so, all right, Alex, anything else from the group on housing, rapid rehousing risk mitigation?
I have a comment. This is
Yes.
Aaron, April, if you don't mind. So I do a lot of housing advocacy across the country with rental credit reports, so it's kind of related. And so I'm aware of some programs that they do housing funding for. It's basically security deposit loans. So community funds would be given to renters. And so the security deposit, say it's $6,000, it would be a loan for that $6,000. And then at the end of the renting, lease, it would come back to the foundation. So that's an interesting idea that we could talk about future, because that's such a high bar, whether it's first, last, and security deposit for a lot of our population. And I know that's happening on some places across the country. That's another thing we could maybe discuss in the future.
Okay,
Thank
you for that. Okay, so we are not going to talk about the emergency shelter written standards because it's a rather lengthy kind of discussion, and I would prefer us to have. I am correct, Megan, that we still do not have quorum. Is that correct?
We believe we do have quorum.
Yes.
Yeah. Quorum, according to our records, is 7.
Oh, I don't think that's accurate,
2,
but
3,
okay.
4, 5.
I don't think that's accurate, but if it is accurate to your records, then we'll take it. So, okay, if that's the case, let's go ahead and take roll call, Megan.
Sure. Okay. April Lott,
Here.
Kevin Marone, Ashley Lowry, Dolores Rafa,
Here.
Erica Gist,
Here.
Steve Blank,
Here.
Jennifer Stasek, Lariana Forsyth, Lieutenant Zach Haish,
Here.
Michael Gelazzo,
Here.
Mickey Thompson, or
Kip
Corview.
I'm the alternate.
Yep. Christine Long, Andy Coble. And that's 7.
Okay, Judith Warren just joined.
Yeah, I'm here. I just have a little bit of background noise.
Sure.
Is Judith on the list as a authorized member?
No, Victoria might be able to speak more of that. We're still waiting for an application.
Yeah, that application has been sent but has not been completed and received.
Okay. Judith, if you could look into that, get with Michael. I know he travels quite a bit, but
Yeah, I'm actually with Michael right now, so I
okay,
can
you guys
get
could
him
just
to
get
weigh in
that.
if need.
Yeah, if you could just get that signed and T's crossed, I's dotted, and get set back in so we can have your voice at the table representing St. Vincent de Paul, that would be great.
We'll re-forward that today.
Thanks.
Okay, thank you. Okay, very good. Well, then we'll go down to the consent agenda. Did everybody have an opportunity? Can you pull that back up, Megan, the consent agenda? Here we go. Has everybody had an opportunity to review the minutes? If so, can I get a motion to approve?
I'll make a motion to approve.
Okay, and a second, Lieutenant Haish?
Second.
Okay, so we have a motion to approve in a second. All those in favor say aye.
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 Okay.
Aye.
Same sign.
Aye.
Okay. Opposed. Wonderful. Thank you very much for that. Moving on. So we do have quorum for the service expert election. Does anybody who is currently on the call and not serving as a service expert, is there anybody who would like to throw their hat in the ring? I don't know if everybody heard me say that Lariana's term as a service expert expires at the end of the month. She is eligible for another term, and she is willing to serve in another term, but did say that if there was somebody else who really wanted that opportunity, that she would step aside. So is there anybody else who would like to throw their hat in the ring for consideration as a service expert?
Can you tell me a little bit about what the position does?
It is a representative. We have 4 of these seats. It's a representative of the Providers Council, who then has the requirement and obligation to represent the Providers Council and sit on the board of directors for the CoC, and then brings forward the issues and discussions that have taken place at the Providers Council level that would need to be shared and discussed at the CoC table.
Got it. Thank you.
Mhm. Okay, I do still feel, because we are missing so many people, the need to send an email out just to make sure, because I do know that HEP, for example, has often expressed an interest at being in that seat. And so if, I just want to make sure everybody's had an opportunity to think that through. And then if not, then we will put Lariana forward again for vote, because she is willing to continue to serve. So if it's okay with everybody, I think we will pause on that, give everybody else an opportunity who wasn't here today, and then take action, maybe electronically. Is everybody okay with that? Okay. All right, so we heard about risk mitigation. So let's now talk about the initial review of emergency shelter standards. Oh, Sherry is not here, so I'm very sorry. Sherry is out sick. And unable to do this presentation. I failed to remember that until just right now. But just know that emergency shelter standards are being reviewed, and we'll come back to that at a future meeting. Okay, the next up on the agenda is about priority populations and interventions. So as you all will remember, we spent the last, I don't even know how many months, it feels like forever, to take action on our priority populations, which we have recently done. So I am not eager to open that can of worms just yet. It's not the time to do that. We have literally just settled on the priority populations. So what really is important, I think, for us to begin kind of thinking through are the priority interventions. As you know, there are a variety of interventions, and we are often being asked by HUD and others to prioritize one intervention over another. I'll just use an example. When we prioritized prevention, especially during the pandemic, it was targeted prevention in certain zip codes using that data. We were actually very successful. However, when we prioritize one intervention over another, like rapid rehousing, things start to shift. And so anyway, there is a survey that has been put together. We prematurely sent that survey out to providers because we had not yet discussed that survey here. And so really that's what we're looking to do now, is to kind of talk about the survey and talk about the need for the survey, and see if we can't get approval on the survey so that we can get that survey out. Megan, can you, is this the survey here? No. Yes.
Yes.
Okay. So can we kind of go through a little bit of the survey? I would want to, no, go ahead. So question number 4. So I would want to take out question number 5, because that's not something we're talking about. We've already done that. And I don't want to confuse anybody with all of that. Take out question number 6. We've already done all that. Okay. And then we would, kind of move question number 7 up to question number 5 and begin to gather data from Providers Council on interventions and gaps and top priorities in terms of addressing homelessness. All of this would then be kind of gathered in aggregate kind of form, and we would provide that information to Funders Council. So just as a reminder to the Providers Council, we really have been tasked with kind of priority populations, and Funders Council is really the council that's tasked with prioritizing interventions. And what we've heard from Funders Council over the years, right, is that they really do appreciate hearing what the providers believe are the needs, and what, providers are seeing and feeling and observing and experiencing. So we would then aggregate the data that would come from this survey and provide that information to Funders Council. So what do you guys think about that? We can keep going down so you can see question number 7, question number 8. Can we keep going down, Megan? Question number 9. 10. So absent the questions really about priority populations, I love the survey. I love the questions. I think they get to the heart of what we're trying to gather. Does anybody else have any other thoughts about the questions we aren't asking, questions you would want included? Kathleen?
Yeah, are you sure you want number 10? It's just kind of, I mean, I can see it either way.
I think we could move it, remove it. I agree. I think it just, creates opportunity for mess. So I would say, Megan, that we would want to remove that question number 10 as well.
And then what's your timeline for getting, so who are you sending this out to, and what's the timeline for a response before the next sequence would be to get it to funders, and hopefully sooner rather than later, as they're going to be looking at budgets at the very beginning of, next year. So what's that process or procedure look like?
Well, really, the procedure is that we needed to review it here first and take action on it, and then it would go to the entire Providers Council electronically, and we would ask them to respond. We had given them approximately, I think, a week or 10 days before. So I think that we could get it out. It's pretty simple. I think we could get it out if we take action on it today. We could get it out with a get it back to us by 12/31 or 12/30 or something. That would give people 10 days or so, 15 days to get it back in. I would be okay with that.
You think maybe like January 5th or whatever that Monday is? I mean, because it's the holiday, I don't know. And then I'm thinking of when's the next funders meeting that.
Yeah. Does anybody know, Victoria, can you tell me that? When is the next Funders Council?
So Funders Council does meet on Monday. So our next business day, the 16th. After that, I'm not sure off the top of my head. Megan, do you happen to know? If not, I'll pull it up.
We were trying to reschedule the joint meeting from October that was canceled for January. I need to send out those dates for the chair's review. Other than that, I believe February 21st and December 19th are also the funders independent meetings. They would meet in the morning as we did last year. So that's still up for approval by that council.
What do you think about doing it the joint one in January, April?
I love that idea. In fact, I was just getting ready to say if we can make that happen, because it would be lovely to be able to have the survey results at a joint meeting so that there could be a discussion with Funders Council. And if they had questions about things, right, that we would be right there to be able to answer them or address them in the moment. So I hope that can happen. I will, again, following this meeting, I'll reach out to Kevin and let him know, because really he is the chair for Providers Council and would need to weigh in on that. But I personally love the idea of that. All right, so we do have quorum, so I would like to entertain a motion to approve the survey with the modifications that we've talked about, and that as a part of that motion that we would get that out as soon as possible, including today, to the Providers Council. Really? Nobody wants to make a motion?
I'll make the motion.
Thank you, Michael. I gave you the whole motion.
I know. And I was
All
going
right.
to say, I'm like, I don't want to make every motion.
Oh, can I get a second? Thank you, Lieutenant Hage. All right, we have a motion and a second. All those in favor say aye.
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 Wonderful. All right, thank you guys very much for that. Thank you to the HLA staff for pivoting as we needed you to relative to this topic. All right, next up is the CoC priorities. What is that, Megan?
I believe that was just an attachment from last
Okay.
year's priority populations.
Okay,
Yes.
perfect.
Mhm.
All right, so next up then is the PIT. Who
Yeah.
wants to talk to us about, oh, you're providing us with the PIT report and the PIT dashboard and the HMIS dashboard. I appreciate all that. Can I just ask where we are with point in time right now?
Absolutely. Actually, I was going to ask if I could mention that at the end anyway. So thank you,
Good.
April.
Uh-huh.
Point in time count volunteer registration has begun. Everybody on this call should have received that information in email. If you haven't, please check your junk folder and make sure my constant contact emails aren't going to your junk folder because we put important information in there. I will also go ahead and put the flyer in the chat here for everyone in a minute. We need volunteers. The point in time count is January 30th, and we do very much need volunteers. We are moving forward with the traditional survey this year, like we have every other year, even though the hurricanes have definitely delayed this process. So we are asking everybody to help recruit volunteers. Michael, we are talking to the school board about this, I am happy to say. And if anybody else has other connections, please let us know. Judith, St. Vincent de Paul has invited me, and Aaron has approved me going on a St. Vincent de Paul podcast to talk about the importance of PIT to St. Vinny's employees. So
Great.
thank you to your team.
Awesome. Will it be your
Absolutely.
debut?
It will be my podcast debut for sure.
All right.
So thank you for that. And if anybody else has other volunteer recruitment opportunities, please let me know. Please share PIT volunteer information with your team members in your newsletters, with your volunteers on your social medias. I can even make sure that we send out the entire packet with a couple of social media captions and graphics and things like that to the entire Providers Council so that you can share it at will as well. All that being said, does anybody have any questions about January 30th point in time count? All right, well, I'm here if you need me.
Yeah, I'm grateful, right, that we are moving forward with that. I think it will be important information, and you know, even if the data feels or seems skewed because we can't be in as many places, we don't have as many volunteers, I do think the data will be helpful in trying to understand. You know, I was informed yesterday, I believe, that you know, all the individuals and families and others who've been displaced as a result of the hurricane, who have been in paid hotel by FEMA, that initially they had been told that that support would go through January, and as of yesterday, that people were now getting letters saying that that support is ending this week or next. So I don't know if you guys are starting to hear that. Erica is shaking her head yes. But please just know that people are starting to get letters from FEMA that their hotel that has been paid for by FEMA in toto is going to come to an end. And so we are anticipating a rather significant influx. I don't know if you guys heard Kip at the beginning say that, you know, the call volume is going down. I think the call volume is getting ready to go right back up because of this dynamic of hotels being paid for by FEMA. And of course, people are not ready to move back into their homes. In fact, I don't know about many still don't even have permits. So they're certainly not ready to move back into their house. Karen, you're recognized.
Thank you, April. Do you know by chance if any of those families upon receiving the letter have gone to the DRC? Because we were on a call earlier this week with FEMA on one of the recovery calls. And that question was asked about the time period ending, because I think everyone did say that it was going to be January. And the FEMA rep that was in the EOC and I think is still in the EOC stated that as long as the people are meeting with their case managers for FEMA, that they've submitted the documentation, that they should be extended. And if they were having issues, they should go to the DRC to have it extended. So I'm not saying that's a perfect solution, but there might just be an avenue to send to see if that really rings true with what FEMA said. I think this meeting was Wednesday that she had reported that.
Okay. I have not heard that information. I don't know where people would hear that information if they aren't right, if they aren't on these calls. But in any case, I'll get that to my team. I don't know that anybody on my team knows that that is an option. So I don't know if you have anything that you could put in writing that we could send out, or if you know somebody who would put it in writing that we could send out.
Yeah, let me see if I can reach out to her. Name's Sally. Let me see if I can reach out to Sally and get some guidance in writing. She may have to get it cleared through several levels of FEMA before putting it in writing, but let me see what I can get. And then I'll forward it to April, you, Kevin, and Megan to send out to the larger group.
Yeah, perfect.
Sure.
Kathleen, you're recognized.
What's if families get a letter from FEMA, they go to DRC. DRC is what?
It's I think it's Disaster Recovery Center. I believe it's in St. Petersburg. Enoch Davis, I think, is the location.
Yeah.
Okay. Did they close? This isn't the Red Cross one. This is a FEMA. All right,
yeah, so it was at the Magnolia Room at Botanical Gardens, and then of course for like the holiday lights, it shifted down to Enoch Davis. But it is supposed to be the one-stop shop for all things FEMA. So rather than sitting on the phone for hours, you're supposed to be able to go there and get assistance.
Okay. And that's the only one in the county down there. See,
I believe DRC, yes. And that should be on the Pinellas disaster website as well.
Okay. Thank you.
Sure.
Lieutenant Hayes, you're recognized.
Hey, so something you brought up, and I missed the first couple of minutes of the meeting, is that Kip was saying the call volume's going down. We went out and counted the whole county on a couple of different nights. And I mean, I went back through and did my whole area again because I was concerned I missed something. And I went through the majority of North County myself twice just because I couldn't believe it. And the numbers of people sleeping, and we're not talking about people sleeping on private property, but the amount of people that are sleeping in public land, on public property, in parks and stuff, it's significantly lower than it has been, and it was over the summer. We canceled the count that we were going to do on the night of the cold night shelters because that would have been pointless. So we went out the other night, and it wasn't that, it was cold, but it wasn't that cold. I mean, we had really, really low numbers. So the hope is that, I mean, obviously from what we're hearing on the street is a lot of people figured out how to get into these FEMA motels that short-term motels, and that's what we're being told on the street is where a lot of this population, where a lot of the people are. But from what we're seeing visibly at nighttime, it's really not there.
Yeah, so the question is, so where did they go, right? And we too have been hearing and experiencing actually the hotels were kind of at 98% or something occupancy. I mean, it's been quite and so understanding who are those people and knowing that many of them, of course, were people who had been displaced from their homes and or their apartments, right? Either home ownership or home renting. So, we know that homelessness wasn't solved, right? So we know that all of a sudden they weren't housed, right? And we do know that we were hearing, of course, that people had left the area, and we're leaving Pinellas County and or whatever due to kind of storm related issues and fears. I am very concerned about this letter I'm hoping perhaps that, what Karen is sharing is going to be impactful pretty quickly. I don't know how quickly all of that can occur, because it's my understanding that it's December 20th. Right. So it's like, less than a week away or something, but that's in these letters. I have not seen a letter personally, but my staff have. And so anyway, so I'm going to be interested, Lieutenant Hayes, if, a couple weeks from now, all of a sudden you see a surge in what you can see and what you can count, because they're now back, and or new people are on the streets. Because I think that's one of the bigger concerns for me, is people who have otherwise not ever been homeless now entering the system. Kathleen, you're recognized.
Yeah, so I'm sorry.
Oh, go ahead.
Just real quick. So what our street outreach people are seeing is we're not seeing a lot of new people to the area. It is the same individuals that we've been interacting with a long time. I don't think we've come across many, if a few, new individuals.
Kathleen.
My question was more, Lieutenant Hayes, when you first made the statement that you're not seeing a lot of people out there in public property, are you implying that our chronic homeless have taken advantage of FEMA free hotels?
I'm saying that I think some of them have figured out and gotten their way into the FEMA free hotels.
Okay.
That's what it sounds like. And from, we're going off word of mouth from one individual on the street telling, our street outreach will go out and look for somebody, and they'll say, "Hey, have you seen so-and-so?"
Yeah.
And they say, "Oh no, he got into a hotel." And that's where that's coming from.
Okay, thanks.
And Cindy has indicated in the chat, right, that they're continuing to watch HMIS and numbers to see if they're going to go back to pre-hurricane count. So we appreciate that as well. Cindy, Karen, your hand's still up. Do you have something more? Okay, go ahead.
Yeah, I just wanted to respond to what Kathleen said. I will say yes. So, we were in shelter for 50 days at the various step-down shelters. And Red Cross absolutely works with individuals who were previously homeless or homeless upon entering, and assisted with applying for FEMA or the HOPE program or their own internal program. So absolutely. That's not a requirement for the Red Cross program that you had a dwelling prior to entering their step-down shelters.
So do we have an idea of when that runs out, when the Red Cross support runs out, or has it? Or, I'm just wondering, like April said, when are we going to see more of a resurgence of our chronics that are generally here?
Yeah, I don't have that data.
So I think that Red Cross, again, I think that their support has virtually ended, except for in very few cases, and that it was kind of switched over, if you will, or transitioned to FEMA. And the initial communication that our clients were receiving was that it was through the 19th of January. And then this week, they started getting letters that said it was the 19th of December. So, and that's been verified now, again, kind of through what Karen said, and that I guess there can be extensions if they are, meeting with case managers and the like. We have not heard that part. And by the way, it's not articulated in their letter that way, which is interesting. But in any case, so I'm going to get that information to my team about the DRC. As you know, one DRC in St. Pete, it can be hard to get to and to do. So it was my understanding that, there were also at times long waits and those kinds of things at the DRC. And we might imagine that might be changing now, as, we've been 2 months post storm or what have you. But I think, Kathleen, that we're going to start seeing it again, between now and January 19th. Again, if they can get the extension, for how long? Is it to the initial date of January 19th? I would imagine that that's what it is. But I don't know that for sure. So I think, it's going to be in the very near future. Everybody has to understand, right, that it's going to run out. So whenever it is, it's going to run out. And, some of you are probably already know, right, that FEMA is paying literally 2 and 3 times the standard nightly rate. And there was tremendous incentive for hotels to participate. And, we've been talking to our clients about, like, listen, do not get kicked out of this hotel. There is no other place for us to put you. We can't just move you to another hotel. Do not get kicked out of this hotel. Because we've been operating at a 97, 98% occupancy rate. So I do think we need to be ready. I do think, in particular, Kip and his team over there at First Contact need to be ready. Street outreach teams and others need to be ready as well. I do just want to call our attention to the links that are in the report. If everybody's had an opportunity to kind of click on those links and look at the data, I do think that the PIT dashboard is, these dashboards can be very helpful. And to encourage everybody to really read the point in time report. I always think it's so valuable in terms of the information and some of the analysis that's kind of done, changes, things that we can see in the report, and then the dashboard itself will be interesting to see if it changes this year based on kind of these storms that we're just now talking about. Any questions, any thoughts? Go ahead, Victoria.
Yeah, I just wanted to highlight, Kip had put a question in the chat that I didn't want to get missed. Speaking of data, do we have an idea of the number of FEMA TSA vouchers in Pinellas?
I do not. Do you, Karen? Anybody have that information? I do not. I do know, right, that, some of the FEMA trailers have been delivered or set up, and people getting a FEMA trailer. I think at one point I thought that there was going to be a whole lot more of that than there has been. And I don't know if anybody has any updates on that. This is really specific, I think, to people who have never been homeless but have lost their home, including an apartment that I think are going to hit the streets. And they're not prepared, not that anybody's prepared to live on the streets, but certainly people who've never been on the streets before aren't going to be prepared for the streets. All right, anybody know anything about it? Making sure I'm not missing anybody. Okay, well, I think we should try to find out as much as we can, and maybe it's the DRC that can give us some of this information, or the individual that Karen is going to try to connect us to might be able to give us some intel on some of it. So as we get it, we'll share it with the HLA and see if we can't get it out to others. Okay, next up is, I'm assuming I'm turning this over to you, Kip, for the 211 counts data dashboard. Is there anything you want to talk to us about there?
No, I think it's the same thing as usual. Basically, our calls are mostly about housing and utility assistance. I mean, that's really the primary thing. We've shifted from calls being primarily about disaster and sort of disaster response to more of status quo ante, I would say. But to our previous discussion, I really am interested in the numbers of people who are on TSA who might re-enter the market and then call us, so that we could prepare and maybe even staff up for that. But again, it's really December tends to be a slightly less call volume than other months. It picks up, in the spring, and peaks in July and August. And so kind of we're in that last of that froth before it picks up into the new year.
I will say I did get noticed yesterday about kind of a, what I'm going to call our first no camping bill implication. So apparently there was an individual who was, approached by law enforcement and told and issued a trespass. They were there again, and so they were told, right, that they would be arrested. They were able to call our street outreach team. We went immediately there. So no arrest actually occurred, and that individual was sheltered. We asked that they, give us a minute, and so they were sheltered actually in hotel. And so there was no arrest, but for my team, my street outreach team, it was the first kind of implication, if you will, around the no camping bill. Although I will say that it worked, the system worked. They were able to get to street outreach was able to respond, and we were able to get them off the street. So it worked, and which is a good thing. Had they not gotten us, and it hadn't worked, I don't know. I don't even know if we would know about it at this point, right? Lieutenant Hayes, that's a good question. Do you know of any arrests that have occurred?
So, okay. So there cannot be an arrest under House Bill 1365. There is no crime that occurs under House Bill 1365.
Okay.
What the law enforcement officer has to do is take action on existing trespass authorizations that are already on file with municipal sites, public lands, all that stuff. So the only thing that I am aware of, and it's coming at secondhand information from me, is that there have not been any arrests. It's just education and moving along. As far as I mean, I can only speak to our agency, but we're not making arrests under House Bill 1365. I met briefly with the sheriff yesterday, and I let him know that the numbers he was going to be getting sent to him were lower than the previous numbers that were submitted prior. So he was relieved by that. The last thing we want to do is have this sweeping motions, and it just from our perspective, it's not happening.
So it was not your agency. It was not the SO. It was a different agency, so a trespass had been issued prior.
Yeah, I mean it's standard protocol. It's how things have to be enforced in order for unfortunately for compliance to be gained. Sometimes it's just that it's part of the step in order to. It's a necessary step in the process, but I'm glad it worked out. So.
Me too. So we'll just keep our eye on that. Again, I think there's a lot of dynamics at this point at play, including post-hurricane FEMA vouchers and the like. So, okay. Anything else on these dashboards, these embedded reports, anything that anybody has that they want to, including the HLA staff, anything that you want us to highlight, anything that you want us to take away from the information that you've provided?
Hey everybody, Victoria again. I just wanted to make sure that everybody knows that the information here is available so that as the discussion is started and the survey is done regarding priorities, that you have access to this data. If there is more detailed data, other data that you want our team to pull, please let us know, and we will go ahead and do our best to gather that information. But we thought that this data, at least here, could provide a very good start. So please let us know if there is anything else that is required.
Thank you, Victoria. On the PIT dashboard, the evictions, I did think that was an interesting number. And I'm not sure what we can deduct from the number of evictions. We do know a lot of people are very resourceful, and if they're evicted, that they can still land on their feet. But what information did you want us necessarily to take away from this number, this evictions, the 146 evictions?
That was something that we wanted to share because evictions have historically made it so much harder for people to secure permanent housing. So knowing that folks do have evictions in their past, that this is something that many people in our community are facing, is something worth considering. I will note that that is self-reported data. And I think one person wrote that they had like 13 evictions in their survey. And so we do have to take that information, that might be right. I sincerely hope that honestly that person hasn't had 13 legal evictions. So I will say that the eviction number, again, it's self-reported. Some of them may be legal evictions. Some of them may not be. Some of them may be my mom kicked me out, and then I had nowhere to go. So just so everybody has that in their head when looking at that number, that's really what that is. I hope that answered the question, April.
Yeah, no, you answered it perfectly. I wonder if we couldn't, at some point, right, just overlay it with the number of recorded evictions in Pinellas County, right? There's a number, right? If they're recorded, we should be able to pull the number. It would be interesting to know how reliable this data actually is. And so this is in their past, not necessarily in the last year. This evictions in Pinellas County it could be over the last 10 years, it was 146 or something.
Yes.
Okay. That's helpful. Okay, we've reached the part of our agenda where it's general discussion and public comment. Are there any things that people would like to, I'm sorry, Lieutenant Hayes.
No, just something I was noticing, and I don't remember the meeting schedule for the Providers Council. And believe me, I'm not asking for a meeting to have a meeting. I hate that. But what I noticed is that we were approving meeting minutes from February for the Providers Council. Did we have to cancel a meeting because of the hurricane, because I'm looking at the 2025 schedule, and are we going to have 2 meetings, or are we going to be able to move forward with things and approve stuff at the joint meetings?
So yes, we are going to be able to move things and approve things at the joint meetings. And so what you can see in the minutes, right, is the last individual Providers Council meeting. What you're not seeing, right, are all the meetings that took place that were joint meetings there. So we have had several joint meetings since this meeting. And then one of our joint meetings actually is the one that was canceled during October, right? That was the hurricane. So we only have 2 meetings by ourselves, Lieutenant Hayes, February, December. The other 4 meetings we agreed would be joint meetings with the Funders Council. So we should be only seeing in December, February minutes. And you know what I mean? And in February, seeing December minutes. So.
Okay. I want to make sure we're good with something sitting on the table for 9 months that had a concern on a record. That's all.
Yeah, fair observation. And I would say that we would ensure that we can get those on our joint Funders Council, Providers Council agenda so that would not occur.
Sorry, can I ask a question really quickly, sure. April? Okay. So we actually did include the independent meetings minutes in the joint meeting immediately after this, but we were told at those meetings that the joint meetings didn't want to vote on the independent meetings. So I just want to make sure that procedurally we're doing the right thing. Do you want us to include them for review, but not action items during joint meetings?
I think that would be a lovely compromise.
Okay. Absolutely.
And then we won't, people won't feel like that it's been, a long time since we've gathered. So I think that's a fair compromise, Victoria.
Perfect. Thank you so much. I always just want to make sure that we're writing things down the right way. So thank you.
Kathleen?
Can we request that the HLA staff, just so we have somebody on the record, reach out to that disaster recovery center to try to get a number on the number of people in FEMA hotels for our joint meeting in January? I think that'd be really important to have that number, especially if anybody got an extension through January. Is that coming? Our pit count that's going to happen at the end of January, what are we, anyway, I think I'd love to have that number like right now. So at the January meeting for sure would be super helpful, I think, especially so the funders and providers can look at it and say, wow, look at what we've got here and what might we be up against.
Sure. Victoria, would you be willing to take that on and see if you can't find a team member of yours to get that information?
Yeah, April, if I can be recognized, I would it be helpful if we can maybe get a FEMA rep to speak at that meeting?
I have been working on that for quite some time unsuccessfully.
I can try too, but we'll
Please.
certainly reach out to get the number as soon as possible for that meeting. And
Yeah, because I think it's going to be too late, right? Unless we have a joint meeting in January, which hopefully we will, and so perhaps if we could get somebody there, but at the very least, and they're very, very busy, right? And coming from somebody, right, who lost almost everything
same
from a hurricane, right? I don't want to take people away from trying to do all the things they're trying to do.
Yeah. We'll get as much info as we can, the numbers.
We can get the information to allow us to be helpful
to
the people that we care about, then but if we could get them there, I think that would be lovely as well. So I'm not poo-pooing that. I'm just simply saying, in the absence of that, maybe if we could get the
we'll certainly get the numbers and with that too. Yes, thank you.
Okay, so anything else that anybody has that you want to share? Anything else for the good of the order?
Yeah, I did have something for the group. This is Aaron. I put into the group chat an article. The Largo City Commission was potentially going to pass a city ordinance about feeding groups of 6 or more, which the article talked about really pushing feeding homeless. And it's interesting. I kind of wanted to talk maybe where this number of 6 is coming from, because I know Lieutenant Hayes has talked about, in terms of the anti-camping bill, they're not really targeting unless it's groups of 6 or more. And so now I see the city of Largo looking at, well, we're not requiring permits for feeding groups of 6 or more. And I'm wondering, where is that number kind of coming from? Do we know? Is this becoming a Pinellas County thing, that it's 6 or more that the anti-camping bill is being focused on? The Largo City is saying now you need a permit for 6 or more. Are we anticipating that? Is that something that just happens to be coincidental? I find it kind of interesting. And the article I put into the chat is, to me, it's kind of sad. And I find the article alarming. I thought would be interesting for discussion. I saw Kathleen, maybe you had your hand up about it.
Kathleen, you're recognized. We can't hear you, Kathleen. You're on mute. You're on mute. Kathleen, you're on mute.
Sorry, April, I forgot to be recognized. I don't know anything about this, so I'm going to read that article. But my initial response to you all, I mean, you all know this. I know that there are different philosophies about feeding people out in public like that. But I'll tell you, I helped do those feedings with Beacon Street Ministries in Clearwater for about 3 years every Friday at the municipal services lot. And there are a number of people who show up or who showed up at that location who were living in homes. They were not unhoused. They just could not make ends meet. And so to have it, characterized as these are homeless individuals only, I think is incorrect. I just want to go on the record that that's not everybody who shows up at those kinds of feedings, so.
Lieutenant Hayes, you're recognized.
Yeah, the number, I clicked on the article. I haven't read it yet. The number 6 was, so what you're referencing, I have no idea if there's any correlation, but the number 6 was just an agreed upon number when we were discussing the House Bill 1365 preliminary, like what are we looking at? What would be a big congregation of people? And that was just kind of a number that was determined in that group. It's not like a written set in stone number. There's no implications with that number. It was just a number that everybody agreed upon. But as far as targeting, if the word targeting, you know, we're hitting every location, not targeting them for enforcement, but targeting, you know, for education. So it doesn't matter how many people were out there. Obviously, the higher populated areas we're going to go to first and prioritize, but we're hitting every location where we notice somebody that was sleeping in public. So, but the 6, I have no idea about the correlation between that and what the city of Largo is doing. But the most cities have some sort of ordinance against public feeding. But I know the larger cities do. So yeah, I don't know.
Yes, I have not seen this article either, so I'll have to take a minute to, you know, to review it. And I live in the city of my address is Clearwater, but I live in the city of Largo proper. So, you know, I have a very good relationship with all these people, and, you know, I certainly can reach out and just see. In fact, a member of the city of Largo city council sits on the board. And so certainly we would be able to have that conversation with Donna Hauk to find out, you know, kind of what she's seeing and what kind of got this going, and what the 6 number, you know, where that came from, what the relevance is, you know, those kinds of things I think would be probably best heard from the city of Largo, as opposed to speculation. It does seem coincidental perhaps, but you know, that we would get that from Donna. So maybe Victoria, you know, we could put that, or Aaron, we could put it on something to reach out to Donna and see if she'd be willing to speak to it at the next meeting, you know, that kind of thing.
Thank you, April. I think that's great. Thank you.
Okay, anything else for the good of the order? Okay, seeing none, I hope you all have a very happy holiday and a safe holiday, and everything goes well, and we'll meet again or see you again if I don't see you before then, after the first of the year. All right, thank you. Thank you
All
so
right,
much.
thank you.
Okay, all right, bye.
Thank you.
Mhm.
Bye-bye.